Hi, my name is Lisa Koester, and I have worked hard for my associate's degree as a medical administrative assistant. I've learned a lot in school, and I'm eager to continue to learn as I enter the healthcare industry within my career. I have a MyCred account that I was able to create an e-portfolio with. Within this e-portfolio, you will find a lot of the work I completed during school, showing some of my proficiencies in certain areas. I know as a medical administrative assistant, I'll be dealing a lot with insurances, and throughout schooling, I've researched a lot of information about health insurance plans, such as Blue Cross Blue Shield, commercial health insurances, as well as Medicaid and Medicare. You'll see in my e-portfolio, you'll be able to reference some of my research located under the Academic Service tab, labeled Healthcare Reimbursement and Billing Emphasis. Managing population health and knowing how healthcare reimbursement affects practice management is important for any healthcare professional to know. Health insurance impacts many things like the patient and their health, as well as the reimbursement for a healthcare practice. In school, we have gone over many billing and coding, records management, and scheduling skills. I have obtained these skills, which I believe will make me a valued employee. I know with the ever-growing healthcare industry that medical secretaries will be handling more administrative tasks that is related to billing and coding. I've learned how to input medical information in a patient's record, and I've taken courses that were strictly related to transcribing dictations. I've also learned a great deal on how to properly fill out a CMS 1500 and a UB04 claim form for the different types of health insurances. I have some of sample forms that I've compiled and added to my e-portfolio, which are located under the Academic Service tabs labeled as such. Now that more individuals are required to obtain health insurances, providers will see an increase in the services they provide, which means an increase in the reimbursement for those providers. I've learned so much about health insurance, such as their deductibles, co-insurances, and co-pays. And there are a lot of different plans like HMO, PPOs, EPOs, and POS plans. Schooling has also taught me how to utilize appropriate current technology and resources to locate, to evaluate information needed to accomplish a goal, and then to communicate it. In reference to this, I've completed work and attached this to my e-portfolio labeled Intro to Information Literacy under the Academic Service tab. A medical administrative assistant will have several duties and tasks to complete, which include answering telephones, taking messages, transferring calls, scheduling appointments, and maintaining databases and filing systems, whether they are electronic or paper. One major thing that I have learned is how to process insurance payments using that CMS 1500 claim form and the UB04 claim form. I have learned and obtained important qualities like integrity, interpersonal skills, organization skills, and writing skills. Also, hospital and health systems will grow, so the need for a more reliable and compliant practice in order to mitigate revenue for health systems so it can expedite and optimize proper payment of claims, a reduction in billing mistakes, and reduce the chances of an audit. If there happens to be stuff that I'm not fully knowledgeable on, I've learned different techniques and places where to research to find out what I do need to know. Being able to perform administrative responsibilities, which include the management and processing of information, and being able to organize and communicate that information. I had to research different diseases and conditions. I had to organize the information I obtained about each one of those, and then depict which one had the greater effect on a patient, which had the biggest and most profound effect on the body, which had the best prognosis, and which one had the worst prognosis. After sorting through all of that and organizing all the information I had to then compile it into a paper and communicate my findings effectively. This research paper will be found once again in the Academic Service tab labeled Anatomy and Physiology 2. I've also learned how to incorporate refresher training as a means to keep staff abreast in any changes in the healthcare rules and regulations. Last but not least, I had to employ strategies for reflection on learning and practice in order to adjust learning processes for continual learning. By diving into this assignment, I was able to learn more about something that I am passionate about, which is the patient's rights for their own healthcare decisions. If you would like to read further into my standings in this area, you can do so by reading the material in my e-portfolio labeled Practices in Analytic Reasoning within the Academic Service tab. This also requires one to be open-minded in the fact that all patients have rights, but you also need to continue to learn when those rights need to be reevaluated and when a proxy or healthcare professional need to start making healthcare decisions for their patients. I've learned so much in school, and I know I will only continue to learn more. I know as I graduate, I will be ready to enter the job field as a medical administrative assistant.